And now, Maine Web News.
Governor LePage has announced more of his cabinet nominations. Walter Whitcomb has been selected to lead the Department of Agriculture. Mary Mayhew has been selected by the Governor to head DHHS. The Governor has also nominated Paul Sigonolfi to serve as Executive Director of the Maine Workers' Compensation Board.
And I will allow them to stand and face questions if you would like. If you have any for me, shoot now because I'm heading out real quick. We have to go to Walter Scowy. Yes, sir. Okay.
Governor, what sort of marching orders, if you will, have you given to Mary Mayhew for taking over Health and Human Services?
We basically first thing we're going to do is I'm going to work with her very closely on the welfare side of things, on the mental illness side of things, because I've had a lot of experience in the last 10 to 15 years. We are going to work together in finding help in those areas. The ball in her court is take health care that we have in Maine. We have Dirigo, we have Maine Care. We have issues with the hospitals that we still have to pay our bill. And we have affordable health care coming down the pike. So take a look at it. Work with people in the industry, and let's find solutions for Maine people. That's the direction she's going to be taking.
And when you say find people to work with, do you mean some deputy commissioners who specialize in those areas?
Yes.
Governor, you said you had a chance to look at Trish Riley's report. Are there aspects of the Dirigo program that you'd like to preserve? What's the future of that program? And
no.
I mean, what's the future of the program like this?
Mary and I will be discussing that in the near future. We haven't made a decision on it, but I haven't seen anything about Dirigo that I want to preserve.
Governor, in your press release talking about Mary, you said that you're going to try to help Maine families break the cycle of dependency. Can you talk about that for immediate term and long term?
In the immediate term is, quite frankly, in the very, very near future, I'm going to go spend a lot of time with DHHS. We are getting, I could say, over 1,000 letters in the last 10 days on complaints about that department. And I'm going over there and we're going to see what's going on and why people aren't getting the customer service that they deserve in the state of Maine. In the short term, we are going to help the needy. In the long term, we need to make policy, public policy, that will not allow people to fall through the cracks. And that's what's happening today.
What sorts of complaints are you hearing?
Unresponsive, unwilling to provide good customer service, and if the policies and the rules don't allow people to be helped today, is where do they go? And then we're saying we can't help you, and it's just not very friendly. And so we need to find that out. We have enormous number of complaints on fraud. And some of them are brought in by police chiefs, some are brought in by people from the department, some are brought in from just neighbors or people in the state. So we need to explore that, we need to take a look at those.
It almost sounds like a restructuring.
We'll see. Okay. We'll see. I can't say that at this point. My goal is to be more customer friendly, to provide good customer service to those in need in the state of Maine, both in the medical insurance side, the mental illness side, and the entitlement side. We are not looking to throw anybody to the curb. We are trying to make sure that we provide the services that they need. With one little caveat, is we are going to work very, very hard at getting people to become self-reliant rather than completely dependent.
Governor, it was just 12 days ago where you appointed Mary to your inner circle for healthcare policy, and now you've moved her to DHS. How do you think she'll be more helpful to you there than she would have been, as part of your inner circle?
That's a good question. We've been discussing that, and she's going to be very sorely missed on our senior staff. But we really, I will tell you, be very, very candid, and I thank Mary for stepping up and saying that she would do it, because we have interviewed an awful lot of people from all over the country. And I will tell you right now, I have been rejected more by women in the last 2 weeks than I did in 4 years of high school and 6 years of college. And it's all about money. We can't pay enough. And some of those ladies are right here in this room. So it's about, and Mary is very, very valuable. In the last, just in the time she spent on the transition team, she's done a marvelous job in bringing us up to speed on some of the challenges that we are facing in the Medicaid side, particularly when affordable health care comes down, the reimbursement rates are dropping, not going up. And we're already at the lowest reimbursement rate in the country, so we have some real serious issues to be addressing. And I think Mary's ready to do that.
What qualities does she have that make you the person for this job?
She understands some of the issues that are coming down in healthcare, and we have a real serious issue in main care, in Dirigo, Medicaid reimbursements, we're not paying our bills, and so I had to find somebody to stick it with. To stick it with, and Mary said she'd take care of it.
Governor, can you comment on the national health care vote today in Washington and Maine's participation and how important you see this?
I'm sorry?
On the national health care vote in Washington today?
Quite frankly, I've been stuck in there in meetings since early this morning, and I don't know what the vote was.
Governor LePage, have any?
In the process of developing some sort of a broader, far-ranging plan for health care in Maine. Will Mary work with you on that? And I guess what kind of shape can we expect that to take?
Frankly, we have an awful lot of work in healthcare. I am hoping that we join the suit against the national healthcare system, and I hope that we can defeat it on a constitutional basis. I will tell you something. From what I've read and what's just been handed to me, I don't see how we're going to pay for it. Because right now it's taken up a significant percentage of the budget. And if you think education's expensive, wait till you see this package.
Governor, this says that all 3 nominations will be considered by the Appropriations Committee. Isn't that a departure from usual procedure where it goes to the Policy Committee?
Isn't it policy? I thought.
What's that?
Usually ag takes the ag.
It's a typo.
Yeah, I think so.
Governor, on agriculture, have your red tape removal meetings produced any ideas for increasing Maine's food production by reducing regulations?
I will tell you that the red tape audits have produced an enormous amount of suggestions, and we keep getting them. Just this week alone, in since last Friday, the 2 I've attended, many more suggestions have been. So the answer to that is unequivocally yes. An awful lot of recommendations are being made in the ag side, the DEP side, the alert side, the labor side, energy side, you name it, we're getting recommendations for reform.
Do you have priorities for any particular industry within Maine's agricultural network of various departments, such as dairy or blueberry? Sometimes those different interests wind up competing for fairly scarce state resources. I guess what have you learned so far about what you'd like to see as far as an agricultural level in general?
Quite frankly, on the agricultural side, I have not set an agenda yet. I'm waiting to get the commissioners on. We have been working very hard in the area of DHHS, i.e. the healthcare issue and education, because they eat up 80% of the budget, and that's where most of my time has been spent.
Governor, before you leave, can you comment on this morning's newspaper headlines?
That's last week's news, and I'm moving on. And I have no more comments about anything to do with that issue.
One last question about the agriculture. Governor, last week at the Civic Center there was a group looking to preserve 100,000 acres at $50 million. Even though we are an aging state, this is still the 5th youngest farming state in America. So what do you do to help the Agriculture Department transition that so it gets into the right hands of some of these younger farmers?
I will reserve comment on that until Walt has a chance to get up to speed, and then we'll talk about it.
And on workers' comp, we hear so much about workers' comp from different viewpoints. Obviously, it's a big expense to business. Do you think it needs major reform?
Well, let me tell you, there's one reform that I will tell you right now that I'm going to ask workers' comp people to consider. When a business in Maine has to make a report in 24 hours, but an injured employee has 90 days to tell the employer, I think we need to address that issue. That is a significant issue. As someone who's been in business, and someone comes in and has never said a word to you, never knew anything, has worked all along, and comes in on December 22nd and says, I got hurt in October on a Monday morning. I said, did you report it? Oh, of course not, I didn't have to. That's a problem. Because you can't prove it, nobody's talked about it, so it's all one-sided. Whatever that person says, you have to deal with, and I don't think that that's fair to Maine people, it's not fair to Maine employers, and I believe that we need to be sitting down at the table and discussing it.
Today's episode of Maine Web News is brought to you by Hearth and Home Realty. Whether you're buying or selling your home, contact Hearth and Home Realty at 696-4247 for all of your real estate needs. That's Hearth and Home Realty, 696-4247 on Outer Main Street in Madison.